These are more specific guidelines on management of severe acute malnutrition in infants and children, so like the hospital management and then hospital care for children. So IMCI is a community outpatient-based assess, refer if needed, handle what you can at your location, and then WHO has more booklets for us to use in other settings. This is the healthservicecorps.org website, Christian Health Service Corps website, where we actually have links to the online training for the IMCI as well as integrated management of pregnancy and childbirth. Okay, so measles is a highly contagious virus that's transmitted through direct contact and respiratory droplets. It remains active for up to 2 hours. And the infected person is contagious 4 days prior to when their rash erupts until 4 days after their rash erupts. Up to 9 out of 10 susceptible people with a close contact to a measles patient will develop measles. So one of my other questions when I started looking into all of this was, why are we so focused on measles? Well, it's really contagious, and it has the sequela or the complications that we talked about. So we talked about cough, coryza, conjunctivitis. Koplik spots are actually white spots in the mouth, and this is depicting, it's not a great picture, but it's from the CDC, trying to depict the Koplik spots. And we talked about the complications, and then death, right? Death is a complication of almost anything. But in developing communities, so in the majority world, in the areas where we're working, there's a 3 to 6% death rate from measles. If we go back to my talk this morning on displaced groups, there's a 30% case fatality rate for measles in displaced groups like refugees because they're living in close quarters. So supportive care, hydration, nutrition, antibiotics for any concomitant infections, and the vitamin A doses are here. If there's signs of vitamin A deficiency, you would give a third dose 4 to 6 weeks later, and vitamin A reduces the number of deaths by 50%. Another encouragement, so WHO has a global vaccine plan for measles and rubella, and between 2000 and 2018, there was a 73% decrease in measles deaths that was attributed to this global vaccine action plan. So this was actually studied and attributed to. That was 20.4 million deaths that were prevented with this global vaccine action plan. But in 2018, 140,000 children still died of measles. So we just talked about 3 to 6% case fatality rate in general in the developing world, but a 30% case fatality rate in a refugee settlement. So how would the case change, or what would you do differently? You would use the Sphere Handbook, which under child health standards, so now this is one of those sections of health standards, there's a child health standard, there's childhood vaccine preventable diseases, and you would conduct a mass vaccination campaign if the measles immunization is less than 90%. If the immunization rate in your camp or in your community is less than 90%, you would, or unknown, which is the more likely thing, you would conduct a mass vaccine campaign. And it says measles immunization is a priority health intervention because of that high contagiousness and the high mortality for it.